Good morning. Hi, good morning, everyone. I felt truly honored, and it's a great pleasure to be here, and I'm glad to have some background music accompanying my presentation, so I'm truly honored by that. But it's really speaking from the Chinese community's perspectives from this really important issue of elder abuse, and especially addressing it from its very unique cultural and social context of elder abuse. Do this? Oh, okay. And I like to open up speaking more about the population aging perspective and its relation to the support system in the Chinese aging population. So we all know that China right now has the largest elderly population, but its proportion is also going to increase at a very rapid rate. So by 2050, we're going to see 1/3 of China's population will be composed of senior citizens, which is about 3 times higher than its current proportion. And if we're putting this on a global scale, we're also seeing that 1 out of 4 of the world's elderly population will be Chinese. But this has to be put into perspective in terms of the family support, the support that they may be getting, partially because of the one-child policy that was put into effect in 1979. So we'll be seeing that when one child reaches the working age, he or she may be taking care of 2 parents and 4 grandparents at the same time. So that's the structure that we are seeing. And this trend may be also echoed in the U.S. Chinese population, as we know that Chinese population in the States is the oldest, largest, and among the fastest growing Asian American subpopulation. We're seeing 1 out of 4 Asian population is of Chinese descent. But also at the same time, it's also increasing rapidly, especially in the past 50 years, due to the fact of the Immigration Naturalization Act of 1965, that Chinese population has been increasing in the country in a very unprecedented rate. But at the same time, we're also seeing that Chinese elderly, especially Chinese elderly women, are actually experiencing a higher life expectancy of around 86 years, which is higher than the general population of about 67 years. Before going to more specifics, I wanted to acknowledge the inherent cultural and linguistic diversity existing within the Chinese population. We know the predominant population, the Han population, is about 90% in China, but at the same time, there are about 55 other ethnic nationalities. That's about 40% of equivalent of to the U.S. population. And all these 57 ethnic groups, each of them speak different languages, different dialects, and different written scripts. For instance, the example that I listed here for the Mandarin speakers, which is the official language spoken in China, is basically from a Mandarin speaker's point of view, they cannot understand someone who speaks Cantonese or Sichuanese or Shanghainese. The differences between these languages, according to linguists, are as far apart as French to Italian or English to Dutch. And that's diversity that we're facing in terms of public health research in China. And obviously, the written script is also a byproduct that's relating to the cultural diversity. However, there are some very commonly shared cultural traditions in Chinese culture. So as many of you are probably had heard of it or familiar with the filial piety in Chinese saying that we say, out of 100 virtues, filial piety comes first. As you can see, the little drawing there is a character in Chinese that symbolizes xiao, or filial piety. And when this character was created 5,000 years ago, we're talking about the drawing, the bottom, the purple part actually symbolizes the character of the sun. And on his shoulder, it's the symbol of older adults. So this is how the construct or the conceptualization of filial piety traditionally, that means basically older adults and sons or daughters are signing an intergenerational contract that rearing children for older adults is protective against older age, against frailty, or against vulnerability when people grow older. And also other relevant cultural traditions or still deep embedded issues in the cultural beliefs are the value of harmony, the value of collectivism, especially in the immigrant communities. What we're seeing here is that the immigrant families may often prioritize the whole family's well-being and attainment over individual pursuit of success. So sometimes the senior's predominant role in the family may be changing, may be modified in different contexts. And also in terms of help-seeking behavior, the concept of faith and fatalism, of really preserving the family's reputation, and also in terms of afraid to lose face or thinking that certain health problems were to occur because they're doomed, because it's destiny, may also deter them from seeking timely medical treatments. In recent times, not only in the US, but we're also seeing a lot of crossroads that are facing Chinese families. First, we're talking about increased life expectancy for seniors, which also means increased support that there will be needed from adult children. And we're also talking about financial dependency, the lack of pension, well-organized pension system, lack of insurance, social change in China right now brought about by urbanization, migration workers, etc., are also threatening some of the very fundamental basics of family support system. So in face of these challenges, actually the Chinese government, by about 20 years ago, back in the mid-80s, they actually started this filial piety contract, which is actually, the official name is the Family Support Agreement, that started in the rural areas of China. So although it's a voluntary contract, but by signing this contract, it's usually encouraged by the adult son to take up this responsibility. So any violations of this contract will be penalized by law. So that's the importance of filial piety and the family support that's expected of adult children. And the situation is probably similar in the U.S. Chinese families, if not greater, that they're transforming from a traditional culture to Western society's emphasis on a lot of individualism. Especially, we're talking about a population in the U.S. that Chinese older adults, about 80% of them are foreign-born, about 30 to 40% of them immigrated after the age of 60, which means that they're already retired. They immigrate into this country primarily for reuniting with their family members. In our work, we also have been increasingly seeing that a lot of older adults address the primary reason for migrating to this country is actually to take care of their America-born grandchildren in order to really continue this cultural heritage or lineage. But at the same time, they're experiencing some very pronounced linguistic and cultural barriers to healthcare, which will really expose them to some of the very critical health-seeking behaviors. So about a couple of years ago back, we really wanted to start looking at elder abuse, this issue in our community. And we wanted to understand the scope of elder abuse, not from a conceptual framework from the researchers or literature, but more importantly, we wanted to hear from the older adults' perspectives. How do they perceive elder abuse? What are the components? Who are the victims? Who are the perpetrators? What can community do about it? So rather than impinging on the existing literature. So this is one of our earliest qualitative work, which I'll be including some of the quotations later on. And one of our most recent research effort is really the PINE study, which is a population-based health and well-being study of over 3,000 Chinese elderly in the greater Chicago area. And this is, to our knowledge, probably the largest cohort of Chinese elderly ever assembled in epidemiological studies in the Western countries. For this over 3,000 Chinese elderly sample, we're sampling older adults ranging from 60 years old to 105 years old. And we wanted to really attribute the study and the report to our academic community partnership that's strictly guided by the community-based participatory research approach, which by definition we are really seeing academic partner and community partner equally engaging in the research process, not only ranging from the project conceptualization, but also in terms of what type of questions should we ask? What's the culturally and linguistically appropriate ways that we can address these questions in terms of data collection, also in terms of disseminating these information to our community. And a very important part of this CPPR approach is the community advisory board that we have assembled is really about 20 members enlisted from civic, health, social organization in the Chinese community. And in the regular meetings, one of the very critical health issues identified is the question of elder abuse. So from the Chinese American Service League, so we are the largest and oldest and most comprehensive social services really dedicating to helping the Chinese Americans in the Midwest. I wanted to really start talking more about our understanding of elder abuse in the community. And I also wanted to point out the prevalence here for us is really the prevalence indicators, the experience of elder abuse that's reported by older adults in our community. And we're seeing 1/4 of older adults who experience any form of abuse, and followed by 1/10 in psychological, 1/10 in financial. And from the quotation here, we can see from the seniors' perspectives, they do perceive elder abuse as an existing problem in the community. And also addressing some of the cultural perceptions of elder abuse. When they're acknowledging the brutality consequences of physical abuse, psychological abuse is still considered worse than physical abuse. And consistent with other ethnic minority groups, we're seeing the key form of disrespect, cursing, ignoring them, as really even worse than the physical abuse, the consequence of physical abuse they may have to encounter. Caregiver neglect here is also was considered as the most common form of abuse. And this construct, caregiver was most likely identified to be either a son or a daughter-in-law. And that's what we have been capturing in the community. The very unique factor here I wanted to spend some time with is really the changing expectation of filial piety. We do know that right now the practice of filial piety is really in its very different provisions based on local circumstances of familial social configurations. But we do see that in our community, filial piety is still very highly expected of adult children. We're seeing overwhelmingly 90% of older adults that exhibit above average expectation on respect, please and make happy, etc. But at the same time, for the 6 key constructs of filial piety, we're also seeing a paradigm shift, by which I mean they place a lot higher expectation on the emotional component of filial piety, rather than the traditional construct of providing material support or financial support as compared to the 43% expectation on financial support. The quotation here I included, I really wanted to point out 2 things. One is that the changes from more of a traditional Chinese conception of collectivism transforming to the Western individualistic centered influence, they may potentially create some cultural conflict that will make older adults be more vulnerable and frail to abusive situations. And secondly, it's also that if they still possess high expectation of filial piety, but at the same time, the expectation is not being met, this potential discrepancy between expectation versus the actual receipt of piety may also predispose them to associated with consequences of elder abuse. I wanted to also add in this slide to really illuminate some of the life course and victimization narrative that we talked a little bit about yesterday from different panelists, is that from our study, we see that 1/3 of victims who screen positive to elder abuse actually experience other forms of violence before they turn the age of 60, so including child abuse, IPV, or sexual abuse. So what are the factors that expose them to be victimized twice? What are the unique cultural or social contexts that we need to take into consideration in this life course narrative? Last but not least, older adults at the same time, they do recognize the very adverse health consequences associated with elder abuse, ranging from depression, loneliness, or the social support that we talked a lot about yesterday, is that they're already at higher risk of social isolation. And as a consequence of abuse, they may be at worsening social isolation. The very, perhaps the most detrimental health consequence of elder abuse identified by our participants actually is the suicidal behaviors. In our PINE study, we have captured about 4% of seniors that we interviewed in the past year have identified suicidal thoughts that they had meant to, they had thought about hurting themselves, and about 2 per 1,000 sample had actually did something to hurt themselves in the past year. And the lifetime prevalence is obviously higher, as you can see in the bar chart here. And the quotation here, I really wanted to capture, the narrative here is that for them to experience something in the elder abuse in the family dynamics, that there is really a heightened sense of helplessness, of fatalism, of really not knowing who to turn to, and suicide may be a very convenient way out. Last but not least, the perceived health-seeking behavior also echo with the previous presenters is the cultural barriers of stigma. In the same Chinese culture, whatever happens in the family, it stays in the family. So it's not only a complex picture of social barriers or structural barriers of not having the right language tools or resources to reach out to the intervention resources, but at the same time, it's also this cultural barriers of stigma and fears that may prevent them from seeking entering intervention resources. So last but not least, this is really the key role of community that can play in designing a culturally and linguistically appropriate prevention intervention model that can really fit to the needs of Chinese community in our case. We see that the participants or seniors we work with, the only resource that they know of, if anything were to occur, is really turn to the community centers that offer bilingual and bicultural resources. And especially in the Chinese culture, we're also talking about not only elder abuse is alarming, but at the same time, how do we offer resources and services that can nurture the filial piety values and intergenerational relations? And our study and project really benefited from the CBPR research methodology that we see that elder abuse, a very traditionally sensitive or taboo project, or taboo topic, is actually we're able to stir very open discussions about it, not only in terms of how they perceive abuse, but in terms of what type of resources will be necessary for them in order to intervene or prevent elder abuse from happening. So for instance, the World Elder Abuse Awareness Day that we have organized about 2 years ago back, it's probably its first kind in Chicago, that we invited in a very intergenerational perspective that seniors are invited to write about what is a ideal intergenerational relationships. At the same time, young generation are also invited to contribute in their thoughts in this family dynamics. So I wanted to conclude here by really bringing out some, or planting some seeds about what's the next steps. So I cannot emphasize the importance of community partnership, not only in terms of designing the CBPR research, but also in thinking about prevention and intervention in terms of moving forward. And we do need to expand our research agenda to illuminate some of the very culturally unique risk factors, protective factors, and health consequences relating to elder abuse in our community, as well as other communities as well. So I hope that later on, perhaps the workshops today will have more time to talk about the practical policy implications in terms of really providing services that are tailored to the needs of different communities in this really growing minority-majority phenomenon in this country. So I really appreciate your time. Thank you very much.